For those of you who do not know me, my name is Crystal Back, and I am the Pediatric Immunization Nurse Coordinator here at Kentucky Department for Public Health's Immunization Branch. As you heard me mention to Chelsea a few minutes ago, normally my coworker, Tara Pendergrass, who is our Immunization Coordinator and Outreach Coordinator, would be here presenting the end of it for me, but she is not available to be here today as she had a conflict, so I will be taking care of her part as well. But however, I will provide both of our email addresses at the end, so if any of y'all have any questions later on, you can reach out to either of us. And I'm going to turn my camera off while I'm presenting, so my internet sometimes is a little bit unstable. So that is why. So let's get started. Here at KDPH, our vision is to have healthier people for healthier communities. Our mission is to improve the health and safety of people in Kentucky through prevention, promotion, and protection to create healthier people and healthier communities. Today, we are going to be focusing on the evaluation, reporting, and monitoring of childhood vaccines. We will discuss the impact this has on the accuracy of the state school survey and provide strategies to improve the understanding of state regulations, ACIP vaccine recommendations, and best practices related to pediatric school certificates and immunization review processes. We will also review the updated back-to-school toolkit that has multiple resources that are available for you all to use. The interpretation of Kentucky regulations, ACIP vaccine recommendations, and the use of KYR are essential components of the school survey process. Inaccurate reports can result in low vaccination coverage and potential outbreaks of vaccine-preventable diseases. So some of the materials I am sharing today, you may have saw before if you were on our early childhood presentation. So I want to quiz any of you who may have attended our last presentation. So looking at the screen, can any of you guys tell me which of the two certificates is expired? I'm sure you can tell because it's at the bottom of it, the one on the right. And do you all remember how long a parent or guardian, or do you know how long a parent or guardian has to have a current certificate on file once a child is enrolled at school? I'm not seeing anything pop up in the chat, so I'm going to go ahead and go over it. Kentucky mandates that every student must have an immunization certificate to enroll and attend school as described in 902 KAR Chapter 2, Regulation 60. Kentucky has regulations requiring immunizations for children in childcare and school. A current immunization certificate must be on file at the school within 2 weeks of the child's enrollment. So here are 2 samples of a Kentucky certificate of immunization status. And as you can see, the child on the left is considered up to date and has a valid certificate that doesn't expire until 4/19 of 28. Then we have the child on the right that is not up to date and the certificate is expired. When a child is not up to date, the certificate should also be marked as either a provisional certificate or medical exemption, with the reason a child is medical exempt written out. A provisional certificate may be valid up to 14 days after the child's vaccine is due, so the child may go to school and allow time for them to get an appointment to get caught up in that time frame. So good practice would be to keep these certificates that are marked not up to date out or in a folder that is marked with the month that they will expire to enable you to send out a reminder to the parent that immunizations will be due and the child will need an updated certificate. This would also be good to do with the current certificate that will expire in the current school year. So again, some of you all may have seen this before. So just looking at it, just think if, you know, if a blank certificate may be used, if it's not printed from KYR for school attendance, if it is handwritten. And another thing to think about, do you remember what must be completed for this form for it to be considered complete and valid? So let's consider that this form is completed per the Kentucky regulation and is marked to the child is not up to date, and there's a check marked for provisional certificate, and the date listed is for 5/31/24. Could this child still attend school? Yes, a child may have a provisional certificate, and as long as the date listed has not passed by yet, then the child may attend, but must have a new updated certificate to attend once the date has expired. So if not printed from KYR, a blank certificate may be used. Per Kentucky regulation, it may be handwritten, and it must include the name of the child, the birth date, the name of the parent or guardian, the complete address of the child, the date that each dose of each vaccine was administered, and type of vaccines that have been administered. It should be marked that the child is current for immunizations until a specified date, including a statement that the certificate shall not be valid after the specified date. So the top right-hand corner has a place for the name, address, and telephone number of the healthcare provider, practice, pharmacy, local health department, or licensed healthcare facility that is issuing the certificate. The bottom of the certificate should be signed either in ink or an electronic signature along with the printed name of the physician, an APRN, a physician assistant. I'm sorry, guys, if y'all can hear my pup in the background. A pharmacist, a local health department administrator, or a registered nurse or licensed practical nurse designee of a physician, local health department administrator, or other licensed healthcare facility, and it also must be dated. So a completed EPID 230A form must be on file for a child when a parent or guardian declines vaccination due to religious declination. In addition to the EPID 230A form, KDPH has created parent instructions for completing the form that includes all the steps that must be taken for the EPID 230A to be considered valid. This is available on KDPH's immunization webpage, and you may review and share with parents who may be inquiring about the religious declination form. So this may be a little bit hard to see, but on the right, you can see an image of the instructions for completing the Commonwealth of Kentucky parent or guardian's declination on religious grounds to required immunizations, which is the EPID 230A form. And it instructs the parent to obtain a copy of their child's immunization certificate from either their local health department or their medical provider, and that all the immunizations the child has ever received must be listed on that certificate. Religious objection must also be marked at the bottom of the child's immunization certificate. In addition to the EPID 230A form, they should obtain a copy of the EPID 230A form either at the on our immunization branch website, or they can get one from their local health department. The top portion should be completed by placing an X in the boxes to the left of each disease for which the parent objects to the child receiving an immunization, and it should be initialed and dated in the boxes to the right of each disease that is objected. And then also it should be initialed after the statement, due to my religious beliefs, I object to my child receiving the required immunization selected above. I am aware that if I change my mind, I can rescind this objection and obtain immunizations for my child. The child's full legal last name, first name, and middle name, and the child's date of birth using the format of month, day, year on the lines that are provided. The parent or legal guardian can take the unsigned form and their legal ID to a notary public. If they don't know where to go, most time you can visit your local library, so that's also instructed on here. And the form must be signed in front of the notary. So only when the notary public signs and dates will they actually have a current and valid EPID 230A Commonwealth of Kentucky parent or guardian's declination on religious grounds to required immunizations. The current and valid EPID 230A form must be presented with an EPID 230, which is the immunization certificate, to satisfy the requirement. So here are some true or false questions. If y'all had seen the previous presentation, if a child has already received some immunizations before the parent claims a religious exemption, this includes the birth dose of hepatitis B, both the EPID 230 form, which is the immunization certificate marked religious objection, and EPID 230A, the declination on religious ground forms, should both be submitted. True or false? So that is true. A certificate that is marked religious objection should only be reviewed when submitted. Do you guys, anybody know if that is true or false? Okay, so that is false. A certificate marked religious objection should be reviewed when the child's next vaccine would be considered due. The EPI 230A form must be an original document, written, sworn, and signed before a notary public. And the document cannot be accepted without it being signed by the notary. So here, you guys can scan the QR code, and there's a link that takes you to the EPI 230A form. And again, this form must be on file for a child and a parent or guardian declines vaccination due to religious declination. And like I said, it lists each required vaccine, and the parent or guardian must mark an initial and date each vaccine or immunization that is objected based on religious grounds. It must be the original document, written, sworn, and signed before a notary public and submitted upon enrollment. If a child has already received some immunizations before the parent claims a religious exemption, this includes a birth dose of hepatitis B, then both the EPI 230 marked religious objection and EPI 230A form should be submitted. So for best practice, regardless of immunization history, a certificate should also be submitted to the nurse, or the nurse may look in the KYR to see if the child has had any past immunizations and then print it from there if they wish. A certificate that is marked religious objection should be reviewed when the child's next vaccine would be considered due. Kentucky Law, Title 902, Chapter 2, Regulation 60, Immunization Schedules for Attending Child Daycare Centers, Certified Family Child Care Homes, other licensed facilities which care for children, preschool programs, and public and private primary and secondary schools lists the immunizations required for different age ranges in order to attend. It also states that all required vaccinations be received in accordance with the minimum age and intervals between doses as recommended by ACIP. So the next several slides shows immunization requirements based on the child's age. The table here shows requirements for a child that is 4 years old up to 5 years. And as you can see, the left column has the vaccine that is required, and the right column shows how many doses of each vaccine is required based on previous doses and ages they were given. So for example, if we look at the PCV, which is the pneumococcal vaccine, the child may have 1, 2, 3, or 4 doses based on the criteria that is met. A child that is ages 5 years up to 7 years no longer has the HIB or the PCV as a requirement, and DTaP is now 4 or 5 doses. IPV polio is now 3, 4, or more doses, depending on the criteria that is listed. For a child ages 7 years up to 11 years, the only change is that in the DTaP or DTP component, an option to have a dose of TD that was preceded by 2 doses of DTaP, DTP, DT, or TD, or combinations of the 4 vaccines. So note that when we're looking at a child's history, he or she may have had DT, but the DT vaccine, which combined diphtheria and tetanus protection, was discontinued from the immunization schedule in the United States. The last lot of DT vaccine was manufactured in October of 2020 with an expiration date of April of 2023. It is still listed in the regulation. New guidance for children that is less than 7 years old includes that if there is a contraindication to DTaP, that TD may be used for those children. Changes noted to the regulation for a child that is aged 11 and 12 years includes the option of 2 doses of TD after the dose of Tdap, which may take the place of DTaP vaccines. This is also the age group that should now have a Tdap vaccine in addition to meeting the DTaP requirement, and a meningococcal vaccine to mean ACWI dose. So please do not confuse the mean ACWI with the mean B vaccine. Meningococcal ACWI vaccine can help protect against meningococcal disease caused by serogroups A, C, W, and Y, and is a requirement per the Kentucky regulation. Meningococcal B vaccine can help protect against meningococcal disease caused by serogroup B and is ACIP recommended but considered optional. Meningococcal B vaccine cannot be given in place of meningococcal ACWI vaccine to meet the state requirements. A child that is aged 13 up to 16 years has the same immunization requirements as a child that is aged 11 to 12 years per the regulation. A child that is 16 years old or older will now need 1 or 2 doses of meningococcal vaccine, the men ACWI, depending on the age when the child received the first dose, along with the previous requirements. Here you can scan the QR codes or visit the links for the Kentucky Law Title 902, Chapter 2, Regulation 60, and for Kentucky's KRS 21436 for immunization schedules and to see details on exceptions and exemptions. So although the state regulation goes by ACIP's recommended vaccine schedule, not all vaccines that are recommended by ACIP are required for school attendance, but they should be encouraged to prevent illness and school closings due to vaccine preventable disease illnesses. Getting an annual influenza vaccine and completing the COVID-19 vaccine series should be encouraged. The HPV vaccine should also be encouraged to prevent most cases of cervical cancer. This vaccine can also prevent vaginal cancers. In addition, the vaccine can prevent genital warts, anal cancers, and mouth, throat, head, and neck cancers in males and females. Meningococcal B vaccine should be offered at ages 16 to 23 years old, but the preferred age is 16 to 18 years old, so adolescents have protection during the ages of increased risk. Again, do not confuse the men B vaccine with the required men ACWI vaccine. You can scan the QR code or go to the link to visit the immunization schedule based on ACIP's recommendations. A current Commonwealth of Kentucky certificate of immunization status or an out-of-state certificate of immunization status for a child shall be provided by a parent or guardian upon enrollment to child daycare centers, certified family child care homes, other licensed facilities which care for children, preschool programs, and public and private primary and secondary schools. It should be provided upon a legal name change or at any school required examination pursuant to Kentucky Law Title 702, Chapter 1, Regulation 160 for school health services. And additionally, a current certificate should be provided upon enrollment in school when entering kindergarten, 7th grade, 11th grade, or new enrollment at any grade resulting from a transfer to Kentucky from another state, Kentucky from a country outside of the United States, or a school from another school within Kentucky. When reviewing a child's immunization certificate and you find that it is expired, then the child shall be recommended to visit the child's medical provider, pharmacy, or local health department to receive immunizations required and receive an updated and current certificate to be provided to the daycare center, certified family child care homes, or any licensed facility that cares for children within 30 days from when the certificate was found to be invalid. If the child is attending school, then there is a 14-day grace period instead of 30 days for an updated certificate to be provided. Kentucky Law Title 902, Chapter 2, Regulation 55 requires immunization reporting for kindergartens and public and private elementary and secondary schools for children in kindergarten, 7th grade, and 11th grade. The annual survey submitted using an electronic reporting system provided by the Kentucky Department for Public Health shall include the number of students in the grade surveyed, missing immunization records, religious exemptions, declinations, medical exemptions, children who have received age-appropriate immunizations and vaccine-specific exemptions. You can go to the link at the bottom or scan the QR code for more information regarding Kentucky law requirements on immunization data reporting and exchange. The annual school survey is an important tool for monitoring vaccination coverage and identifying areas where vaccination rates may be low. Accurate reporting of the survey data helps public health officials identify schools and communities where children may be at higher risk of vaccine-preventable diseases and can target resources to improve vaccination coverage. In addition, accurate reporting helps schools and public health officials evaluate the impact of vaccination programs and policies and make informed decisions about how to improve vaccine uptake. Overall, accurate reporting of the annual school survey is critical to maintaining high vaccination coverage rates and preventing outbreaks of vaccine-preventable diseases in schools and communities. The link listed will provide more information on the annual school immunization surveys, including links and instructions on how to complete it. If a public or private elementary or secondary school has kindergarten ages 4 to 5 years old and up, 7th grade ages 11 to 13 years, or 11th grade ages 16 and up, then data is collected per the school year. You can scan the QR codes or visit the links provided for more information on Kentucky state requirements on reporting, immunization schedule requirements, and to visit the annual school immunization survey reports. Right, so herd immunity means that enough people in a group or area have achieved immunity against a virus or other infectious agent to make it very difficult for the infection to spread. Every person who has immunity makes it harder for the infection to spread to other people. If you're vaccinated, it'll be harder for the virus to use you to infect other people or to mutate into a new variant. Higher numbers of immune people are needed to stop the spread if a virus is very infectious. The percentage of a community that needs to be immune in order to achieve herd immunity varies from disease to disease. The more contagious a disease is, the greater the proportion of the population that needs to be immune in order to stop its spread. For example, measles is a highly contagious illness. I'm going to play a short video clip that shows how herd immunity works, and I want you all to pay close attention, knowing that the yellow dots in the video represent vaccinated population, the blue is unvaccinated, and the black dots are considered to be infected. So on the top, from left to right, you'll see what happens when 0% are vaccinated. In the top middle, 25% of the population are vaccinated. The top right, 50% are vaccinated. And then on the bottom, we have on the left, 75% vaccinated, the bottom middle is 90% vaccinated, and the bottom right is if 95% of the population is vaccinated. So you can see that even if 75% of the population is vaccinated, the disease was still able to spread, while when 95% was vaccinated, there was very few that became infected. So as I mentioned earlier, as measles being highly contagious, it's estimated that 94 to 95% of the population must be immune in order to interrupt the chain of transmission of measles. So we collaborated with the school health branch in 2023 and created a back to school outreach toolkit. Everyone loved it so much, we have collaborated again to update it for 2024. It includes social media graphics for kindergarten, elementary school, 6th grade, middle school, and high school that can also be used as flyers. We also created easy to read regulations for different age groups, including preschool and school-age children, along with sample phone scripts and a sample deficient health requirement letter that can be sent out on Infinite Campus. There are also many links for additional resources that may be useful. You can scan the QR code to take you to the Back to School Outreach Toolkit if you would like to bring it up. All right, so this is, if you go to our back to school outreach toolkit, this is what the actual landing page looks like when it's clicked on from our website. And as you can see, it is very easy to navigate for specific age groups and additional resources that are available. All of the text you see that is underlined are clickable links, and then you can get to the landing page by scanning the QR code that I have listed. So here are some examples of the social media graphics that can also be used as flyers for pre-K and kindergarten. The top graphic is your child ready to start kindergarten. Contact your child's doctor or nurse today and to schedule a checkup and get up to date on vaccines. Kindergarten ready for enrollment. A child needs to be up to date on the following vaccines: DTaP, varicella, PCV, MMR, Hep A, Hib, polio, and Hep B. You can scan the QR code to find out which vaccinations your child may need. The QR code here goes to KDPH's Pediatric Immunization Schedule. The graphic on the bottom states, get ready for the new school year. Add vaccines to your child's back to school list. Now is a great time to schedule your child's checkup and make sure all vaccinations are up to date. Find out which vaccinations that your child may be missing. And the QR code here goes to the public KYR portal for parents. The QR code on this one goes to the KYR public parent for portals. Public parent portal. I'm sorry, guys. I'm getting tongue-tied. So here are some examples of the social media graphics that can also be used as flyers. And like I said, this one was a preschool to kindergarten. And here is for 6th grade and middle school. So on the top image on this one, is your child ready to start 6th grade? Take action today to make sure your child is up to date on vaccinations required for school. Middle school ready, children need to be up to date on vaccines and receive the following at age 11: meningitis, ACWY, Tdap, and school physical. Ask your healthcare provider about the HPV vaccine. Scan the QR code to find out which vaccinations your child may need. And this QR code goes to an easy-to-read childhood immunization schedule on the KDPH's Immunization Outreach website. The second graphic on the bottom, 6th grade ready, safe and effective vaccines are available and ready and required for school to offer the best protection. Add vaccines to your child's back to school list. Scan the QR code to find out which vaccinations your child may be missing. And then the QR code here goes to the public portal. So this graphic's for high school, and then the top graphic is your child in high school. Make sure your child is up to date on vaccinations required for school. There's a booster that your child needs at age 16 to offer the best protection against bacterial meningitis. Scan the QR code to find out which vaccinations your child may be missing. And the bottom image, get ready for the new school year. Add vaccines to your child's back to school list. Now is a great time to schedule your child's checkup and make sure all vaccinations are up to date. Find out which vaccinations your child may be missing. And then the QR code for both of these graphics goes to the KYR public portal. And then there will be 4 available Facebook and Twitter captions with a generic back to school that I have listed here, and 3 others focused on kindergarten, 6th grade, and high school at age 16. These sample captions also provide links to the public KYR parent portal and CDC's recommended well-child visits and recommended vaccinations. This sample here reads, is your child ready for back to school? Routine childhood vaccinations help protect your child from serious diseases like chickenpox, hepatitis, bacterial meningitis, measles, and whooping cough, and are required for school. Check with your child's healthcare provider or the Kentucky Immunization Public Portal at publicportalky.gov. For vaccinations and wellness checks that your child may need, visit well child visits and recommended vaccinations at the CDC. And then all sample call scripts include hashtags such as hashtag kindergarten ready, hashtag middle school ready, hashtag school ready, or hashtag vaccine protected. And there are sample call scripts available to use to notify parents that their child is missing required immunizations and or physical. There is one available for kindergarten, sixth grade, age 11, and high school, age 16. In addition to entry and specific grades, there is a generic sample script to use for any child that doesn't have an up-to-date immunization certificate on file. So this may be a little bit hard to see, but in this toolkit, providers, nurses, or other healthcare professionals can print off an easy-to-read summary of required immunizations. This is basically what I reviewed earlier, but it was divided out into multiple slides. There is one that is for preschool and kindergarten attendance that goes from age 4 through 6 years, and the other is focused on school age from 5 to 16 years and older. And as you can see, the far left column has age ranges, the middle column has the vaccine that is required, and the right column shows how many doses of each vaccine is required based on previous doses and the ages that they were given. And again, maybe a little bit hard to see, but this one is focused on school age from 11 years and older. And these will be useful to print off and have laminated to refer to when reviewing a student's vaccination history. There's also an easy-to-read Kentucky immunization requirements for school-age children from ages 3 years to 16 years and older, with QR codes to ACIP guidance and Kentucky 902 KAR 260, which states the regulations. We also want to encourage a positive message on social media, so we created the sticker to use in a toolkit that suggests to share a picture on social media with hashtag school ready, hashtag vaccine protected, and these can be printed on Avery label sheets, number 22205 for a sheet of 2-inch round stickers. And we really want to encourage our providers and nurses and everyone to use and promote these stickers to try to get that positive image associated with vaccines out there, because we all know that social media guides people's thoughts, whether it's in a positive or negative light. In the toolkit, these links are available on the landing page that the school health branch feels will be useful. The highlighted links are new links that have been added for the 2024 toolkit. So you can see there's the parent-friendly child vaccine schedule, the instructions to the declination, the KYR public portal link, and then also there is the Immunization Action Coalition, that resources in other languages. And then there's also AAP shareable video clips and fun coloring sheets that were also created for this tool year, so y'all can print them off in your offices or whenever you maybe have children waiting in their rooms. That would be nice to let them have something to do. These are also included links on the landing page that refer to the CDC's website. The new link on this toolkit is the childhood vaccine quiz for parents. It is a link that asks parents questions about their child. Then it will produce a list of recommended vaccinations based off of the answers they provide. So CDC offers a series of 1-hour web-on-demand videos that will provide an overview of vaccination principles, general best practices, immunization strategies, and specific information about vaccine preventable diseases and the vaccines that prevent them. Each video will include updated information from recent Advisory Committee on Immunization Practices, or ACIP, meetings and votes. There are more than 15 webinars available with continuing education available for each. So by encouraging this free way to get nurses required CEUs, it will also help prepare them to answer parents' questions and hopefully alleviate any concerns if they have them. The Kentucky Immunization Branch is excited to announce that we will be hosting the CDC's Epidemiology and Prevention of Vaccine Preventable Diseases Pink Book course. This is a 2-day live version of the Epidemiology and Prevention of Vaccine Preventable Diseases course conducted by the CDC trainers. The course provides a comprehensive review of general best practices, immunization strategies, vaccines, and vaccine preventable diseases, and it will also include up-to-date information from the ACIP. It will be held September 11th through the 12th of this year, and it will be at the Marriott Louisville East in Louisville, Kentucky. And you can go to the KDPH Immunization Branch webpage for course details, agenda, continuing education credit information, exhibitor information, and then also the hotel accommodations. Another useful course is Let's Vaccinate. It was presented by Carrie Blackburn and myself, and it can be found on kentucky.train.org. Upon completion of this course, participants will be able to describe infection control measures, vaccine administration best practices, and the importance of immunizing pediatric patients against BPDs. Completion of this course is worth 1.2 nursing contact hours. The links provided will take you to the course itself and the actual PowerPoint presentation, along with the skills checkoff list that can be used. So my key points I'm hoping came across is promotion of this back to school toolkit and the use of the public parent portal. We want to encourage registry use to print certificates, but if they are handwritten, they must be completed accurately per the Kentucky requirement. Kentucky immunization rates need improving, so we also hope that promoting the use of the stickers will encourage a positive look on vaccines in the social media world. And then in a few minutes after Nimi presents, if we have time, I will take you guys to the actual outreach webpage and show you some of the resources and those toolkits and stuff if you all would like. And then if you don't already, follow us on Twitter and Facebook. There are also lots of useful tools and information on the KDPH website, including our immunization outreach webpage that was briefly overviewed earlier today. And then if you have any questions, just drop them in the chat or email me or my coworker, Tara Pennygraph, and we'll be happy to get back to you. Now I'm going to turn it over to Nimi Lavu to share the school survey data with you guys. And thanks for listening and let me present today. Nimi, were you ready?
Yeah, sorry, give me 1 second. I was just...
Oh, you're fine.
Okay, good afternoon, everyone. My name is Nimi Lavu, and I am a epidemiologist with the immunization branch. My role is mostly with the school immunization survey, and I'll be talking about the process behind the annual school immunization survey and some of the data. So today I'll be covering what is the annual school survey, why is it required to complete the school survey, who is required to complete the survey, how is the data used after it's collected, how we collect it, and some follow-up on what we do once we collected this data, and the outcomes and results of this data, and there'll be some points of reflection. So what exactly is the annual school survey? So the annual public and private schools that have kindergarten or 7th graders and 11th graders are required to complete an immunization survey, which is conducted by the Kentucky Department of Public Health Immunization Branch. The purpose of this survey is to identify children entering kindergarten, 7th grade, and 11th grade who are not protected against vaccine preventable diseases, and to ensure that they're properly immunized according to state requirements. Immunization schedules required for attending child daycare centers, certified family child care homes, other licensed facilities that care for children, preschool programs, and public and private primary and secondary schools can be found at this QR code, which is the Kentucky State Requirement Regulation 902 KR2060, or Crystal presented some great tables that she had created, and those requirements would all be on there as well. So the annual, so why do we do this? So there is a Kentucky Regulation 1 58.037 and 902 KR 2055 that requires that any child that is eligible to enroll as a student in any public or private elementary or secondary school without presenting a certificate from a medical physician, osteopathic physician, or advanced practice registered nurse licensed in any state. And it also states that kindergartens and public and private elementary and second schools shall submit to the local health department in their area immunization results for kindergarten, 7th grade, and 11th grade. You can find those regulations using that QR code. The annual school survey monitors vaccination coverage and is used to identify areas where vaccination rates may be low. And it identifies schools or communities where children may be at risk for vaccine preventable diseases. So vaccine preventable diseases, or VPDs, or outbreaks such as measles outbreaks may occur when community members are inadequately vaccinated against a disease. The Kentucky Immunization Compliance Assessment is a great way to understand your county's risk of an outbreak. To keep highly infectious diseases such as measles, chickenpox, and whooping cough out of our schools and communities, we need immunization rates to be 95% or higher. So the survey is used to also target resources to improve vaccination coverage, and it determines the impact of vaccination policies and programs, and accurate reporting is critical. So who is required to submit this? If a public or private elementary or secondary school has kindergartners 4 to 5 years old and up, 7th graders, or 11 to 13 years old, or 11th graders ages 16 and up, then data is collected per school year. The annual survey is submitted using an electronic reporting system provided by the Kentucky Department for Public Health, and it asks for the students in the grades surveyed, like number of students enrolled, the number of missing immunization records, number of religious objections or declinations on file, number of medical exemptions on file, and the number of students or children enrolled who have received age-appropriate immunizations. And it tries to ask for vaccine-specific exemptions, but we currently do not collect that data fully. And all of this is aggregate data, which means that no individual school level data is collected. Student level, I mean. So how do you collect this information? How would you do this? Information on the annual school immunization survey includes links and instructions to complete, and this can be found using this QR code or on our immunization branch main page. The Kentucky Annual School Immunization Survey tools are distributed to the local health departments and all public and private schools by the Kentucky Department of Public Health in electronic formats. So as I was saying, aggregate counts are collected via RepCap, which is an online survey, and then all the survey data is extracted into Excel, where it is reviewed and duplicates are removed. The information is then analyzed, interpreted, and organized into a report. So this year, the Kentucky Annual School Immunization Survey for the 2023 to 2024 school year were distributed on October 30th, 2023 to every public and private school with at least one kindergarten, 7th grade, or 11th grade class. Each child was assessed for the presence of any immunization certificate on file, the certificate's expiration date, and the number of doses of each age-appropriate vaccine received. The deadline to submit surveys electronically was December 31st, 2023. Surveys were then reviewed for reliability and validity, and opportunities were given to resubmit if errors were identified. So valid data that represents the metrics that we were trying to measure. So in this case, that would have been accurate representation of students who have the required vaccines and doses. So if there were more students enrolled, but did not have an ideal number or a very low number of non-compliance, then we reached out to those schools. Or if it seemed like there was a typo on their survey, those schools were reached out to resubmit surveys. In addition, field staff reached out to specific schools to conduct validation on a sample size of students. This process used to be conducted prior to COVID-19, but has not been done since then. And this was the first year we did this again, where schools that had submitted the survey this year were randomly selected and chosen to do this validation, where 30 students from their enroll list were certificates were reviewed by the field immunization staff. We also did outreach to unresponsive schools. More than 3 attempts were made to schools to make sure they would comply with this. But any survey received after April 15th, 2024 was not included in any of our data. And so the outcomes of this can be seen on summary reports and data files that are located on the main school immunization branch website, as well as we do compile all of this into a dashboard that can be found on the school immunization health tracking website using this QR link. And then each year the CDC publishes a report and other documents based on our school vaccine surveys and the data that we provide to them. They only collect kindergarten data. So if you follow this link to that last year's school year survey, you would find kindergarten school vaccine rates that the CDC compiled from us. And then I'm going to walk you through the dashboard. 1 second. And then can you guys still see my screen? Okay. So the school immunization dashboard can be found on the immunization branch main website. If you scroll all the way down here, you will see links to how to complete the survey and instructions, as well as a link to our dashboard and any of the previous year's reports as PDF files, as well as on the immunization health tracking website. If you go here and click on immunizations, it will take you to a table that talks about immunizations, and then there will be links to the 2 immunization dashboards. And now I'm going to walk you through our school immunization survey dashboard. So when you first open this link, it takes you to an introduction or landing page, and then which kind of summarizes what the requirements are for submitting data, and any footnotes that explain how this data was collected, and any so for DTaP, we collect students with greater than or equal to 4 doses of DTaP, but sometimes the requirements might be that, that kids needs that 5th extra dose, but we are collecting any students with greater than or equal to 4 doses of DTaP. And then up here, you'll see a tab for kindergarten, 7th grade, and 11th grade immunization. So if you click on kindergarten, they're all laid out the same way. So I'm only going to walk you through kindergarten, but you feel free to look at this dashboard anytime you have time. And the only difference between kindergarten, 7th, and 11th grade will be the colors on their dashboard. So going back to kindergarten, what you would first see on this dashboard is this table with the current school year at the top, and then going back to 2018 to 2019, the total percentage of vaccinated per academic year based on the number of students that were surveyed. So the all vaccine would be all vaccines required for kindergarten, and then 2 or plus MMR, 4 plus DTaP, 3 plus polio, 2 plus varicella, 3 plus Hep B, and 2 plus Hep A. We do not have any data before 2018 to 2019 on the dashboard due to regulation changes. Those can be found as PDFs on the main immunization branch page, as I showed you earlier. And then below this table, you can see a line graph with the same data. And when you hover over a specific point, it will tell you that year, what vaccine you're looking at and the percentage. And if you wanted to highlight a specific vaccination, you could click on this and it would highlight um, the table up top. And then below this, you will see an exemption and the state level data. So exemptions that, and then you can also select what year you're looking at. So currently we're looking at 2023 to 2024 school year. And then in that school year, there were a total number of students surveyed were 52,609 students. And then up to date with all vaccines were 84.74%. Not up to date with all vaccines were 8.91%. Religious objections were 2.04%. And then students that had no shots or no certificates on file were 4.1%. Again, each student is only recorded one time in each category. They are not counted more than once. And then going to the state level data, it's divided into percentiles of 1 to 80% being most vulnerable, 80 to 89.9% being more vulnerable, and 90 to 94.9% being moderately vulnerable, and 95 to 100% being the safest, with the goal that 95% is when you would prevent vaccine preventable diseases in schools. So if you click on one of the percentiles, it will highlight all the counties that are 95 to 100%. And then if you hover over one of these counties, such as Greene County right here, you can see all of their vaccine county level data. And then if you go down a little bit more, you'll see you can select specific counties and select the school year and select the facility type. Again, this would be individual school level data, but in this table, a graph, there are all the schools that submitted data but had less than 10 students enrolled. Their data was excluded, but their data was not excluded in the above graph. So I'm just going to show you. It looked like there were some people from Greenup County. So let me just pull that one up. And then if you chose the current school year, and then if let's say we only chose public schools that submitted data, and then you could see that Arclight Elementary had 71.79% for all vaccines. And then you could scroll down to see all the kindergarten, all the elementary schools, primary schools that had kindergartners and what their individual school level data would be. Okay. And then going back to the PowerPoint, so what you're seeing right now is the kindergarten assessment for the last school year, 2022 to 2023 school year, which was published in the MMWR report on November 10th, 2023. So this is the Kentucky vaccination coverage data compared to surrounding states and the US national estimate. So you can see here that Kentucky has a greater than or less than arrow because the report coverage estimates for Kentucky represents the percentage of kindergartners with less than 4 doses of DTaP, less than or equal to 3 doses of polio, less than or equal to 2 doses of MMR, and less than or equal to 2 doses of varicella coverage, regardless of appropriate time intervals or ages. So Kentucky is at 90.6% for DTaP, 91.2% for polio, 90.1% for MMR, and 89.8% for varicella. And then right here you can see the national estimate. So Kentucky was lower in all vaccines than the national estimate, but we are higher than some of our surrounding states, such as Ohio and Indiana. And most probably West Virginia, but you have to keep in mind West Virginia does not require the 2 doses of MMR and varicella for kindergarten entry, they only require 1 dose of MMR. So it is possible that their rates are higher because of that. So this graph shows you fully vaccinated students by the school year and grade. So the reported coverage estimate represents the percentage of kindergartners with 5 doses of DTaP, 4 doses of polio, 2 doses of MMR, 2 doses of varicella, 2 doses of Hep A, and 3 doses of Hep B coverage at the appropriate time intervals and ages. So current year data for fully vaccinated is collected from the up-to-date or compliant status for all required vaccinations for age versus the previous year's data, which was collected using valid or expired certificates. And then only schools who submitted the annual survey as of February 1st, 2024 have been used to calculate these percentages. And so here at the current school year data in kindergarten, you can see that 84.7%, and then 7th graders have 80.2%, and then 11th graders have 53.8%. This slight decline in almost all of them, except for 7th grade, could be possible because of inaccurate documentation, or we just had more reporting this year than last year too. So vaccination exemptions for 1 or more vaccines by school year and grade. So the dark blue here will be national kindergartens, and then the light blue will be Kentucky's kindergartners, and the light green will be Kentucky 7th graders, and light gray is Kentucky 11th graders. And then so all exemptions were counted as one category. So either if you had a medical exemption or religious objection, you were counted in as a vaccine exemption. So as you can see, for this current school year, kindergartners had 2.3% exemptions, whereas last year they only had 1.8%. But 7th and 11th graders did go down from last year's 2.8%. And the national average has not been released yet, but for the previous years, you can see that our kindergartners exemption rates have been less than the national average for all of the years prior. So, and then this graph shows the percent of vaccinated kindergarten students by school year. The dark blue will be up to date on vaccines. Again, that up to date would be with all the required kindergarten vaccines given at the appropriate time intervals. And then the not up to date is if they're missing any of the required vaccines. And then the green would be no shots. And then, so this current school year, we had 84.0% compared to last year of 85.7%. And then no, not up to date, 8.9% this year compared to 7.8% last year. And then 4.9% of no shots this year compared to 4.7% last year. And then this is a graph, the same type of graph, but for 7th graders. Again, for 7th graders, that would be 1 dose of Tdap, 1 dose of MenACWY, 2 doses of MMR, 2 doses of varicella, 2 doses of Hep A, and 3 doses of Hep B that were required to calculate this up-to-date status. So up-to-date 80.2% in 7th graders compared to 78.7% last year. And then not up-to-date 16.1% this year compared to 17.6% last year. And then no shots 1.8% this year and 2.2% last year. And then for 11th graders, so for 11th graders, we require that 1 dose of Tdap, 2 doses of MenACWY, 2 doses of MMR, 2 doses of varicella, 2 doses of Hep A, and 3 doses of Hep B coverage. And then up to date for 11th graders this year was 53.8% compared to last year, 59.0%. And then not up to date, 42.5% this year versus 36.6% last year. And then no shots, 1.9% this year compared to last year's 2.5%. But you do need to take into account a lot of these 11th graders when they were required to get that first men ACWYW, it was COVID for them. So they probably are in catch-up schedules. And then since measles is going around, I thought I would pull up some of our MMR data for you guys to see. So this MMR data is greater than or equal to 2 doses of vaccination coverage by school year compared to national estimates. National coverage estimates among kindergarteners and adolescents were pulled from CDC's National Center for Immunization and Respiratory Diseases, and then Kentucky's kindergarten 7th grade and 11th grade data was pulled from the school survey. Dose counts are counted regardless of appropriate time intervals or ages for this particular data. So we might have a higher representation of coverage for MMR compared to what it actually is. So for this school year, you can see that we have 95.9% and 95.8% in 11th and 7th and 11th graders, but only 90% in kindergarteners. Okay. And then some thoughts of reflection. What outreach or education can we help with to increase the vaccination rates, especially in high school students? What barriers are you facing to giving children recommended vaccines? And how can we maintain vaccination coverage levels for all children in Kentucky? And what can we do as a state team to support those who are entering the data at the local level? If you follow this red cap link, you can either use this link or this QR code. There is a short survey for you to take if you are interested in providing any reflection points back to us, or if you have taken the kindergarten annual survey before and you have input to provide us for improvements, this survey would be where we would like you to submit those improvements. Well, and then thank you for your time, and this is my email if you would like to reach me.
Does anyone have any questions for me or Nimi other than what's been put in the chat so far?
Did everybody see in the chat? There were some really great links that Crystal put into the chat, specifically related to the VIS sheets that are in multiple languages, as well as the VAX reference tool that translates immunization records. So if you all have not seen those 2 links, I do encourage you to go to the chat and open those links up so that you do have access to them when this is done.
No one else has any questions right now. I'm going to go ahead and go over the actual outreach webpage. I'm going to share my screen again. So can everyone see?
Yes.
So this, if you is our actual homepage to the immunization outreach website. This is where you can find toolkits and other resources that are available. Whenever you first go onto the website, if you barely scroll down over here on the right, you can see there's the vaccination schedules. We have the adult vaccine schedule, the adult vaccine schedule for immunocompromised, and then we also had the childhood vaccine schedule and the pediatric vaccine schedule for immunocompromised. And if you actually click on this childhood vaccine schedule, which some of the social media graphics I shared with you guys earlier, this is the link I was referring that it would take you to. This we created because it's a little bit simpler and easier to read compared to whenever you go to CDC's immunization schedule for children. Because, if you try to print it, I think it's like 14 or more pages. It's several pages. It's lots of pages long. So this is kind of just a simplified 1-sheet reference that, you could print off and hang up in your all's offices or just to have to refer back to, but it's a little bit simpler than trying to go through the large one on the CDC site. Also, we have the links for the KYR public portal on here. And then also we have like for infant and childhood, all the recommended immunizations. And then if you just click on any of these, it'll go ahead and open up just a one pager that you can print off and have in your office. I think these are all in English. So like I said, we have the translated resources that we dropped in the chat, and then it's also available in the toolkit. But these are just kind of nice to have if something is going on. Oops. I'll get there, guys. Give me a second. I got too many links open. So it covers all the vaccines, and then also there's if you have any questions when you're using KYR or any issues, there's a KYR help desk. So sometimes I know you can run across duplicates, like patients that are in there a couple of different times from different providers, maybe just listed slightly different due to hyphenated last names and other issues. So anytime you come across that, if you just email them at the help desk, they can combine those two charts together into one. You just have to let them know what the ID number is for that, the KYR ID number for those two patients, if they're the same patient. There's also shareable flyers to advertise the public portal in your office. We have it in English and Spanish. Encourage parents to be able to go online and see their child's vaccines. And then for our social media resources, we have a few different ones that's on here right now, but here is where the toolkits live that we've been talking about. So we have the back to school outreach toolkit, which is what we basically just went over, which I'll open up in just a second. Then we also have a Start at 9 HPV toolkit. So this toolkit here is only about HPV and recommending starting at 9 in order to get those children vaccinated. We also have the flu, COVID-19, RSV, and pneumonia toolkit, and then the child care toolkit, which is similar to the back to school outreach, but just for younger children. So if you do see both age groups in your practice, I would recommend using both of those toolkits. We'll look at the back to school. So when you open it, like I said, this is what the landing page looks like, as we shared earlier, and all of these underlined are clickable links. So it's labeled out, you got your preschool to kindergarten for ages 4 to 5, and then here's where you'll find those graphics and flyers. You can click on it and let you see, because there's more than what I shared. So on this one, there's like a total, I think it's 5 or 6. So there's a few different ones other than the ones we shared. So just depending on your preference, or just if you want to be able to share different ones on different days or weeks, especially when you're preparing for back to school in those summer months. Like, well, even right now, you should go ahead and start sharing these on I would recommend to start sharing. If you don't have like a Facebook page or anything, or at least advertise them in your waiting areas or in your office. And then down at the bottom, it has the captions that you can use. And I know I went over those earlier, but you don't have to use these captions. Feel free to, create your own if you want. That's completely fine with us. We just had these just as something easy to use to make it more simpler on you guys. So we have it for, like I said, there was the preschool to kindergarten, then that's the same for 6th grade, except it's the age appropriate flyers for that grade. And then also for high school, we have the immunization requirements for school age children. And this is just a simple tool that you can look and see what a child needs, whether they're in preschool, kindergarten, or the 6th grade, the 12th grade entry, and then high school. And then it's the same for the 6th grade and high school. I think these are all the exact same sheet here. Then we also have what went over the summary of immunizations for the preschool to kindergarten attendance. And this is what opens up that little chart that lets you see on the left-hand side the age, the vaccines that would be would be required, not recommended, and then the actual required doses based on the criteria. And then again, in the additional resources, of course, we have the outreach call script, the public portal link, actual relevant summaries, the KRS and KARs that pertain to the regulation for Kentucky's children in regards to immunizations. We have the religious explanation in Spanish. And then the instructions, we are still waiting for them to be translated, but this will be hopefully a clickable link soon because it is coming. And then as far as the declination in English, we have that here. And then I'm unsure if I clarified earlier or not, but whenever you do have a parent, if they do turn in just this declination form and it has been notarized and completed as required by law, then it does not actually have to have the immunization certificate attached. It is just really good practice to actually have one, especially if they've ever had any vaccines in the past. But as far as the law is considered, if they have this form, then nothing else is required. And then additional resources also include the notice of non-compliance for immunizations and the notice of incomplete health records, health requirements. This is where you can find the Immunization Action Coalition vaccine information, and then the resources that are in other languages, which I dropped in the chat. That's where you'll find that. We also have these AAP shareable video clips. Because we had a request to have some of these on our toolkit. So whenever you go here, you can find out these are multiple just little short video clips. You can either share on social media and play them in your office waiting areas. But there's several different ones. Some of them are in other languages, as you can see. But they're all just really short clips. Most of them I think are under 2 minutes. Like what vaccines do teenagers need, fact check FAQs on kids' vaccines for the AAP. And then we have the fun coloring sheets that I was mentioning earlier that you all can print off for children in your office. This is just, let me see if I can make this smaller. So there's 10, you can print off all 10 and make it like a little coloring book, or you can just do, whichever you prefer, or just give them one sheet at a time. But when they are getting vaccines, we created this just to kind of have, like, if they wanted their own little record to kind of make them feel special, they can color it in or mark it, or the nurse can mark it. We do have a disclaimer that it is not to be used an official record of vaccination, because we know there's people out there that would try that. At least I have run across some that would try that. And then, as if you notice, our theme is kind of adventure theme. So we have draw outer space where they can just kind of draw astronaut on the moon, launching into vaccine protection, protect your tiny tots by staying up to date on vaccines or more. And then goes to QR code link there. But we try to make them all gender friendly and just fun for any child. The color, just kind of adventure, maybe their plans for their summer, because we kind of had that in mind. Summer break, all these kids are excited to be out of school. Most of them are, and at least my child is very excited for summer break. But there's just several of those. Sheets. And they can draw themselves as an astronaut. And they just had it kind of themed, like with their whole thing is Tiny Tots, Big Adventures. Um, the printable school ready stickers. And if you forget, like you don't have to remember what I told you, the Avery stickers, as it tells you up here whenever you click on that link. You can print on the Avery stickers number 22205 for the 2-inch round stickers. And then it recommends to encourage them to put on the sticker after they get in their vaccines and to share it on social media with hashtag vaccine protected, hashtag Team Kentucky. So we try to make this one more school friendly with just, sports and graphics and band and school graphics. And then from the CDC, we also have resources for the BIS statements, immunization schedules for healthcare professionals, vaccine names and the CDC trade names, the ACIP vaccine recommendations, and a manual for the surveillance of vaccine preventable diseases. And then that childhood vaccine quiz for parents that I mentioned earlier. And this is just a really easy tool at it's just a few simple questions that I ask them to answer. So they put in a child's birthday, whether or not they're male or female, if the child's American Indian or Alaska Native, if they have any high risk medical conditions. Then you would select auto apply, and then their sexual history, and then the living conditions. That's not it. I think I filled it out just to kind of see how it went. It took maybe 2 or 3 minutes, if that. And then on results, it'll tell all the vaccines that the child may need. So it's kind of a useful resource. All right, and then I also shared in the chat a link to the immunization branch outreach, just immunization branch website. I'm sorry. But here's where you can find information about that Pink Book vaccine course. And then it has a link, I think, to the agenda. When you scroll on down. Yes. Right there in the course overview, objectives, the presenters. And then registration information and the textbooks. And the attire and continuing education that you can see the link here for. Is there any questions? Would you all like me? I think we still have a few short minutes. I don't know if you just want me to give you back the 10 minutes or if you'd like me to show you all some of the early childhood toolkit.
Crystal, there was one question, and you might have put that in there and the links, but the address again to view needed vaccines. Did you
Address of what? I'm sorry.
to view needed vaccines?
Oh, it's on the toolkit. I can was it for the childhood vaccine quiz for parents? Was that what you're referencing?
I'm not sure. It was a question that came into the chat. That it just says, what's the address again to view needed vaccines? So I don't,
I will drop this in the chat, and then whoever posted that question, if this is not what you were talking about, then just put it back in the chat. Exactly, and I'll try to answer it for you or give you the site. But this is also available on that toolkit.
it says childhood, adolescent, and adult.
When I was talking about like what was in the toolkit or the immunization outreach website page here.
I'm not sure. Randy, do you want to It looks like this is either a question from Brandy Rowe or Krista Alexander. So, I'm gonna unmute.
There are two Krista Alexanders on there, so I've unmuted both.
Okay. Well, I'm actually on Krista's. This is Brandy Rowe. Can you guys hear me now?
Yes,
Okay. So sorry about that.
that's
So
okay.
back in the beginning, when you guys were on the talking about KYIR, there was an address and it was like the public portal at ky.gov or something.
So just to the public portal.
Well, I missed it. You guys gave a vaccine. It said public portal ky.gov for like the needed vaccines. I'm not sure.
Oh, I was probably just saying that, was it when I was talking about the social media graphics possibly?
It was, yeah, it was right before that.
Okay, so when I was talking about the social media graphics, most of them when I was just kind of reviewing what the graphics said, and most of them shared a link to the portal for the parents. Like if you are advertising that on social media or up in your office or whatever, where parents could just scan that QR code and it would take them to the KYR public portal. And then they
Okay.
can get access to actually get their child's vaccination records themselves instead of having to go to the provider's office or.
Okay. Okay, thank you.
You're welcome. Any other questions or? I do highly recommend you all check out the early childhood vaccine toolkit also if you didn't get to review it last time when we presented. It has lots of useful tools as well for that earlier age group. All right. I'm not seeing anything, but
I
that
do not see any other questions. And there was one other question that was in the Q&A, but I believe that you answered that and it was with the same links that you were able to put out into the main chat. So hopefully everyone received those links. It looks like you should. And if there are no more questions, thank you all very much for this wonderful presentation. It's been very informative and I think is going to help people a lot in making sure that they've got what they need. So thank you. And everyone enjoy the rest of your day.